Hello and welcome to Wellbeing. I'm Jack Hodgins. Today I'll be beginning a two-part episode delving into what alcohol use disorder is. Alcohol is readily available in Australia, with its domestic industry worth about $12.5 billion and approximately 40% of the nation's population drinking it at least once per week. Although a part of our culture, it can also become dangerous if abused, being responsible for 1,366 alcohol-induced deaths in 2017 alone. For those that struggle with alcohol and are addicted to it, the condition is referred to as alcohol use disorder. We are talking with Professor John Saunders, a consultant physician in internal medicine and addiction medicine. Professor Saunders' career as a researcher and academic in the alcohol and drug field extends back over 40 years, having published books on the topic and worked on many state and federal Australian government committees. Professor Saunders, through the World Health Organization, is also responsible for developing the Audit Questionnaire, the standardised self-assessment test for alcohol use disorders. Hello, John, and welcome to the program.
Good morning, Jack. Pleased to be with you.
At approximately 85.5%, the majority of Australians drink alcohol. But what is alcohol, and why is it a drug?
Alcohol is a chemical compound which is produced by fermentation, and most commonly fermentation of the cereals, which produces beer, and also fermentation of grapes, which produces wine. And then wine is then distilled to produce spirits. Alcohol has been known since the beginnings of human civilization about 14 to 15,000 years ago. And it has been, as you will appreciate, part of the everyday life of many cultures, but not all. It is obviously particularly part of the English-speaking world, Europe, South America, less so in Asia and less so in Africa. And of course, importantly, there are some religions which prohibit the consumption of alcohol as part of the tenets of their faith.
So what makes alcohol so addictive? Does it release dopamine in the brain? What's the story there?
Yes, alcohol indeed induces a number of neurochemical phenomena. It increases endogenous opioids in the brain, technically called enkephalins and endorphins, and they in turn induce the release of dopamine. Dopamine is seemingly the final common pathway by which any sort of compound which can induce pleasurable effects or any activity which can produce pleasurable effects exerts those effects. So yes, you are quite correct that ultimately alcohol does induce the release of dopamine in the brain, and that is experienced by people as a sense of pleasure.
Culturally, why do you think alcohol is more popular in English-speaking countries than, say, you mentioned Africa there? Why is this so?
Alcohol was introduced and the processes of production refined, beginning in the Middle East, curiously enough, and then it spread to other parts of the world, but in an uneven way. Now, there are significant cultural differences between peoples, but there are also significant biological differences between peoples. And with regard to alcohol, one of the most important of those is that many races in Asia lack the full complement of an enzyme which breaks down alcohol's side product of acetaldehyde. And what that means is that between 20 and 70% of people in Eastern Asian countries experience an unpleasant flush reaction when they consume alcohol. And alcohol for them is therefore aversive. And this occurs within 1 or 2 minutes. And this is known in throughout Asia. And indeed, people may introduce themselves as saying, I am, my name, and I won't have any alcohol because I'm a flusher. That's a very significant biological effect, and clearly it is linked to the traditionally low consumption of alcohol in many Asian communities. That is also seen in the First Peoples of Canada and in the United States, and in some parts of South America, where this gene coding for this particular enzyme is also recognized. So, but as well as that, there are significant cultural effects. I mean, for example, in some religions, alcohol has a very central place. As I said, in other religions, it is banned. So it's a mixture of the cultural and the biological that explains why alcohol is very prominent in some countries in the world and much less so or essentially absent in others.
What defines an addiction?
An addiction is where there is a disorder of regulation of alcohol consumption or indeed of certain other substances. It means that there is a change in the neurobiology of the brain, and that this results in what I summarize as an internal driving force to consume alcohol onwards and onwards, and even despite the harm, in a way that you could say defies logic. But the thing is, the parts of the brain which are affected, which include the mesolimbic system in the middle of the brain, are not sort of part of the intellectual thought processes of the brain. They're sort of primitive zones of the brain. But that is the reality. You get a series of changes in those parts of the brain in relation to repeated consumption of alcohol over time, and those changes conspire, as it were, to produce this driving force. And that really drives the ongoing consumption of alcohol. So, alcohol originally is a personal choice. But for those people who develop the addiction, it's a personal choice no longer. It's a primitive drive, and they are at the mercy of that drive.
What is different in the consumption habits between someone who drinks now and again to someone who has an alcohol use disorder? What are the early signs to tell?
There are key features that you can identify, and we use these key features to make a diagnosis. Essentially, you can simplify it as three central features. The first is that there's an impairment of control over the consumption of alcohol. That the person either cannot keep their alcohol consumption within certain limits, even though they want to or try to, that they spend a lot of time and a lot of effort in consuming alcohol, and often they don't cease drinking alcohol in a particular occasion until they become intoxicated, indeed even unconscious. So that's one aspect of it. The second aspect is that alcohol increases in the priority of that person's life and thinking, so that it begins to take what I call center stage in that person's life, squeezing other interests and activities, and indeed day-to-day responsibilities to the periphery, has a more dominant place in that person's life than it did. And this tends to be a progressive process. And then thirdly, and this relates particularly to the neurobiological changes, you get a series of what we call physiological changes, including an increase in the tolerance for alcohol, so that more is needed to get the desired effect, and or the alcoholic drink appears progressively weaker to the person. And also that if that person who has a disorder ceases consumption or tries to reduce, they experience withdrawal symptoms or are forced to consume more alcohol in order to prevent or alleviate those withdrawal symptoms. So those are the central features of an alcohol use disorder. It's also called alcohol dependence, and historically it was called alcoholism, although that latter term is not much used these days, at least technically.
You're listening to Wellbeing, where we are discussing what alcohol use disorder is. My guest today is Professor John Saunders, a consultant physician in internal medicine and addiction medicine, and also a distinguished researcher and academic in the alcohol and drug field. You mentioned there that historically we've used the term alcoholism. Why is it important that we don't use that term anymore and use the other terms now, the newer terms?
Well, one reason is that it developed a considerable stigma, and it conjured up images of the people lying around in the streets, incapable. And that was a very bad image which people took on board. Now, although there are people who are in that category, we do see them on a fairly regular basis, either personally or in media representations. I have to say that is only about 5% of people who have an alcohol use disorder. Most people who have an alcohol use disorder are in work. They are discharging their responsibilities for family, although probably in neither cases as well as they could be if they didn't have an alcohol use disorder. And so, we prefer to use the term alcohol use disorder as a less or hopefully non-stigmatizing term. It's similar to the use of the term addict. Addict, with regard to drugs, conjures up all sorts of images and is really unhelpful for both doctors like me and health professionals, and also for the person, particularly the person, to be given such a label.
Is alcohol use disorder considered to be a disease?
That's a very interesting question, and there's a lot of argument and indeed controversy about that. The World Health Organization defines alcohol use disorder or alcohol dependence as a disorder. That is one step lower in the hierarchy than disease. So disease at the top, disorder next. However, the main difference between disease and disorder is that the World Health Organization tends to reserve the term disease for conditions where there is a clear external cause, like COVID-19, rabies, and conditions such as that, the various cancers. So for practical purposes, although WHO terms it as a disorder, it is in reality a disease. It is not a temporary aberration. It's not just a state. It is a disorder where there is an ongoing driving force. And as long as that person has access to alcohol, it tends to become a self-perpetuating disorder. And that's important to know because people can get very frustrated, including particularly family members of people who have an alcohol use disorder, when they see the person continuing consumption. They may try to stop for a little bit, but they go back, and people interpret that as just bad behavior. And one of the things that we try to do is to let people with the disorder themselves know, and also family members, that yes, okay, originally the decision to consume alcohol was a personal decision, but it becomes a personal decision no longer. It's something that the person is reacting to this unseen but very powerful internal driving force to carry on consuming alcohol.
So in some ways, does it biologically change the brain permanently over time?
That's a very important question. Some of the changes, the biological changes in the brain, can remit with time, but some seem to be very long-term and possibly permanent. And those long-term changes are particularly involves the nerve fibers connecting the mesolimbic system in the midbrain, which I've described, with the brain's memory banks. And so, even though a lot of the changes can remit and the person no longer feels that urge or craving, things like that, the disorder can be reactivated down the track by further consumption of alcohol. And so the best advice that we can give is that that person ceases alcohol. And I use the terms for the foreseeable future. Now, there are some people who, for some time, can keep their alcohol consumption within certain limits. But my experience is that most people with continued consumption of alcohol gradually increase again their intake and develop the features of alcohol use disorder that I have described.
How long does it take to get addicted to alcohol?
In general, quite a long time. It depends on a person's genetics and family history, and also experiences in early life, which not only predispose to alcohol use disorder, but also accelerate its onset. It also depends on the amount that a person consumes, the frequency of consumption, obviously the duration over specific periods of consumption. But to give you some idea, typically from intermittent consumption to an alcohol use disorder typically takes a minimum of 5 years, and it can go up to 20 or 30 years. It occurs more rapidly in women than in men. And as I've said, there are a number of risk factors and underlying experiences which can accelerate the process. So it is a disorder which develops gradually. And I use the term insidiously because so many people don't know that it's happening when it is happening to them. They may be aware that they're drinking rather more than they did, 2, 3, 4 years ago, but it's a cunning disorder. It really does creep up on so many people almost unnoticed.
For some of our listeners out there that may be noticing that they're drinking a little more, or what are some of the signs that they can identify that they may be developing an alcohol use disorder? How should they go about that?
One of the things that can be very helpful to people is to do a self-test of using the audit questionnaire. And there is a website which I've developed, www.auditscreen.org. And that has a self-administered audit questionnaire, and there is feedback in relation to the score that you have, and also whether broadly you're male or female. And so I would encourage people to do a self-assessment and look at the feedback that they have. And if the feedback indicates that they are in a orange, amber, or red zone, then they may well wish to seek advice from their general practitioner, for example, or a psychologist or therapist, to hopefully reduce their alcohol consumption before it really takes hold. Because you will appreciate that given the fact that alcohol use disorder takes many years to develop, there is an opportunity for people before they have that disorder, but are perhaps drinking more than is safe for them, as it were, to modify their consumption through having such feedback. I think one test is whether somebody easily just stop drinking, a week or a month. If that is something which causes difficulty, or the prospect seems alarming, that's a warning sign. You're taking a sort of personal tack on this. I have on occasions, sometimes when I'm collecting money for charity, abstained from alcohol for a month. It has not caused me, fortunately, any problems whatsoever. I've just done it. Now, if you can do that, it would suggest that you don't really have a significant problem with alcohol. You don't have an alcohol use disorder. But as I said, if you can't do that, or the prospect seems daunting, that's a warning sign.
You're listening to Wellbeing, where we are discussing what alcohol use disorder is. My guest today is Professor John Saunders, a consultant physician in internal medicine and addiction medicine, and also a distinguished researcher and academic in the alcohol and drug field. You mentioned the audit questionnaire there, John. You developed that through the World Health Organization. Would you mind telling us how that came to be?
Yes, indeed. Way back when I was a junior doctor in my early 20s, I became aware that there were a lot of patients admitted to hospitals and seen in the emergency departments who had very severe alcohol use disorders and very severe complications of those, both mental and physical. I was curious as to why they hadn't had any advice, because most of them had never had any advice about their alcohol consumption. And so my thoughts turned to the prevention of alcohol-related disease, and I developed some techniques. And then when I was in my early 30s, I had the opportunity to work for the World Health Organization as a contributor, as an advisor. And there was a project which was getting underway, which aimed to help identify people more systematically who had what was called hazardous or risky alcohol consumption. And I had the opportunity of joining that. I was actually recommended by a boss of mine in London. And then when I came to Australia, I continued my involvement, and then I was asked by WHO to actually develop some form of means whereby people could be identified at an early stage. And so I developed the notion that we should have there should be a screening instrument. The study, which was conducted in many countries across the world, had collected a lot of information about people's alcohol consumption and their response to alcohol. And there were about 150 questions in all. Also, people were examined, they had blood tests. And so there was a wealth of information characterizing, well over 2,000 people in many countries in the world. And so it was a most wonderful sort of database that we had through the collaborating network. And yes, I was asked by WHO to develop something that could characterize alcohol consumption. I decided it needed to be a formal screening instrument. We did multiple analyses looking at what were the questions which best characterized alcohol use disorder and harmful alcohol consumption, as opposed to alcohol consumption which was not risky and hadn't caused any problems. And from those analyses, we chose 10 questions. There are 3 questions which relate to various aspects of alcohol consumption, the quantity, the amount, drinking to impairment. There are 3 questions on aspects of dependence, as I've said, impaired control, priority in life, and physiological features, including withdrawal symptoms. And there are 4 questions 7 to 10, on various forms of harm related to alcohol. And so people self-administer, or it can be administered by a health professional. That's the audit questionnaire. Then a score is computed based on their responses to each of those 10 questions. And if you score 8 or more, that puts you in the category, presumptively, of having hazardous or risky alcohol consumption, or alcohol consumption which is causing harm, or an alcohol use disorder. And there are various gradations. And so if you score 13 or more, that puts you in a category where you're likely to actually have a more significant alcohol use disorder or alcohol dependence. So this questionnaire is used worldwide. It's been translated into over 60 languages worldwide. And yes, I believe it is the most commonly used alcohol questionnaire in the world. At least that's what people tell me, which is nice to hear.
Since you first entered this line of work, how far has our understanding of alcohol use disorders come along?
Oh, very considerably. But it's come along in the research and scientific communities. We still see what are very old-fashioned views that alcohol use disorder is a self-inflicted condition. You're the architect of your own doom, and all this sort of stuff, which is profoundly unhelpful. So although over the last 30 to 40 years, our knowledge of alcohol use disorder advanced hugely, this has not been adequately recognized by many people who are prominent in society.
This was the first part of a 2-part program delving into what alcohol use disorder is. My guest today was Professor John Saunders, a consultant physician in internal medicine and addiction medicine. Thank you for listening. I'm Jack Hodgins, and all of us at Wellbeing wish you well.